An IEP is a written statement of the educational program designed to meet a child's individual needs. Every child who receives special education services must have an IEP. That's why the process of developing this vital document is of great interest and importance to educators, administrators, and families alike. Parent, guardian, and student involvement in the IEP process. Parent involvement. By law, parents are a part of the IEP team and serves as the student's advocate in this process. From start to finish, parent participation should be solicited in all aspects of the process. Student involvement. As part of the IEP, students should be included in the IEP process when appropriate. Once the student reaches 16, some states 14, students should be encouraged to have a voice in the IEP process as well as the transition plans after high school. Referral. The referral process is a written request for evaluation by parent or school personnel where there is a recognition of a discrepancy in the child's academic, social, emotional behavior, and or physical ability that may indicate a need for academic or behavioral support services. Evaluation. According to IDEA, students referred for special education services must undergo a non-discrepancy evaluation to determine if a child has a disability defined by IDEA, gather information to determine educational needs, and guide the decision-making process in determining appropriate support or programs for the child. The process must be completed within 60 days of receiving parental consent. Eligibility. To determine eligibility, school personnel, along with parent or guardians, must meet to discuss the data from the evaluation. This assessment results are used to determine if a child meets the definition or one or more of the disabilities listed. Components of the IEP. The IEP is designed to provide clear and precise special education services and support that will be used to make learning accessible to the student. The IEP components are as follows. Present levels of academic achievement and functional performance, goals, description of special education support services, method for progress monitoring, educational setting, LRE, testing accommodations, date of service, frequency, duration, and location. Expectations for ongoing communication between the teacher, school, and parent or guardian to support the development and achievement of the student. As a required component of the IEP, the team must use relevant methods to assess student progress and provide periodic reports to parents on the progress that the student is making towards meeting annual goals. This provides the IEP team concrete evidence as to whether the individualized program as designed by that team is effective or needs adjustment to services or instruction needs to be made. This information is then communicated to the parents as a way to keep them informed. Discussion of the ethical responsibilities the teacher has to uphold the integrity of the profession as part of the IEP process. As an educator, all teachers must keep the students at the forefront of the learning paradigm by providing adequate support to making learning accessible by serving as an advocate for the student. As a common practice, teachers should take the initiative to identify individualized needs and involve as many stakeholders, systems, and process to provide the adequate support to maximize student learning, reach academic goals, and thrive beyond the classroom.